So I'm Maria Mayorga. I'm a professor of industrial and systems engineering at North Carolina State University. I have a 12-year-old and an 8-year-old, so a middle schooler and an elementary school child. And this is work that's done by a collaborative team of researchers from UNC Chapel Hill, NC State, and Georgia Tech, and East Carolina University. So we've been developing models, simulation models to inform local decision making for COVID-19. And recently, as part of the team that's been reaching out to the local health departments, they asked a very specific question about wanting to know what the impact would be of having masking policies in the schools. So our goal was to come up with a model to estimate the proportion of susceptible students that would become infected throughout the semester, depending on different types of policies that the school could implement, but also different incoming protection levels for those students. So we made a simple model to answer this question for a hypothetical school made up of 500 students. And we tried to make this model very conservative because we have been presenting this model to local health departments who might be resistant against implementing mask mandates. And we felt that we wanted to make sure that they understood how bad the problem could be even under these very conservative assumptions. So for example, we assume that only 2 to 3 students begin the year, the start of the semester, with an infection of COVID-19. And some students are, we call it protected, in the sense that they're either vaccinated or they have acquired the infection before. And then we assume that we might have only one external infection coming in. This could be from a birthday party or soccer practice or church or something like this. And we also test testing policies where we would randomly test some proportion of the students using an RT-PCR test, and then those students would isolate with a very high probability. So I just want to make sure that for this group, I talk about our assumptions. We use an R0 or an R0 of 4, which is very conservative for the Delta variant. I think estimates are 5 to 8. And this is because we got some pushback initially for people that mentioned that maybe children aren't spreading the disease as quickly. So we took a very conservative estimate of that. We also assume that masks reduce infectivity by 50%. I saw the talk earlier that said it could be as high as 75, but in this case, we are not sure the quality of the mask and if students are using them correctly. We do assume high compliance with isolation and with a positive test. And we assume a well-mixed environment. Students are not separated into cohorts, so they could be mixing at lunchtime, recess, or sports practices, for example. And in this case, we're just talking about what happens in the school. And for these purposes, we do not assume any reinfection or loss of immunity. So this would be, the best case scenario. Within the semester, there's no reinfections or loss of immunity. As far as estimating the level of protection, we looked at, we based these numbers on the fact that for high school students, they might be able to, they're more likely to have gotten the vaccine, for example, than middle school students. And in elementary school, it would only be students who have potentially been infected before, but we can change these numbers. So we assume a higher level of incoming protection for high school students versus elementary school. All right, so I just want to, before giving the results, I just want to introduce you to how to interpret the graphs. And at the end, I'll show you the website where you can get these in more detail. But the x-axis is showing the time. So we start with the beginning of the semester, and then we go 107 days to the end of the semester. And what you're seeing on the y-axis is the percent of the susceptible students, those students that were not previously infected, who become infected throughout the semester. So let's see what would happen depending on the different policies. So there's a lot going on here. So I'm going to walk you through the graphs. We test policies related to masking. So that would be the baseline policy. And then we also add testing. So the top two lines, as you can see, are if there is no masking, is the blue line. And you may be able, and you can see that this looks pretty bad, where you have in the elementary school setting up to over 90% of students that weren't infected before will become infected by the end of the semester. And for high school, that is still high at about 80%. Then you might want to do some randomized testing. So in this case, we look at what if we, instead of masking, asked 50% of the students to test weekly randomly, and you see that you could have an impact based on that, but it's nowhere near the impact that you could have if you introduce masking. So if you introduce masking, the red line is mask alone, and you can see that you bring down the infections quite a bit to below 50%. And if in addition to that, you introduce testing randomly, then you could bring down the infections to as low as 10%, for example, in the high school case. So this kind of shows you that the layered interventions work. Now we're focusing in specifically into the middle school. After only 60 days, you have that 80% of the students would be infected that with no masking and no testing. If we had testing but no masking, we could get down to 60% of students. If we did just masking, we could get down to 15%. But if we did masking and testing, we could reduce that further to 10%. And this does not include some of the interventions you all have discussed today, like the air filters and other things like that. So as you can see, in terms of going back to our hypothetical school, this graphic just shows the number of students who are in the number of new infections over time, and that masking, even without testing, is quite effective. But if you can do both interventions, that would be best. So what does this all mean? As we all have been discussing, Delta is very infectious, and since kids under 12 are not eligible for vaccines, they remain unprotected. And without masks, it's possible that 90% of susceptible students would become infected by the end of the semester if the incoming protection is 30%, though I think it might be even lower in some areas for elementary school. But mask and testing in combination can prevent many of these infections. And it could be even higher if we assume higher quality mask and well-fitting mask and other filtration systems like you all have been talking about. So I think what our team has been saying now is mask up or go virtual. I think that seems to be like what is happening, because in many of the schools that have opened up, they have had to close or go virtual within the first few days. So I think that these numbers are quite conservative. And as someone earlier spoke about, virtual is not a great alternative for our children. So if we want to keep the kids in school, we have to require masks. And just want to make sure to mention that we did not consider many of the other effects of kids missing school and the potential infections that could happen outside of the school. So we're working on the model right now to estimate the community level impact of masking within schools as well. And if you want more information, I'm showing here the website, our email address, and there's a preprint of our article at this address here.